Hello, my wonderful friends. Today, we're going to talk about something that's very close to my heart, and I know it is for many of you as well. Navigating pregnancy while you have a beloved cat at home. It's such a special time in your life, and the last thing you want is to worry about your furry family member. I get so many questions about this, and the first thing I always say is yes, you can absolutely have a happy and healthy pregnancy with your cat by your side. It's all about being informed and taking a few simple but very important precautions. The main reason this topic comes up, the big concern that we hear about, is something called Toxoplasmosis. It's an infection caused by a tiny parasite, and it can sometimes be found in cat feces. While it's a serious concern for a developing baby, the risk of getting it from your indoor cat is actually quite low, especially if you know what to do. It's a bit like a procedure I might do. It looks intimidating, but with the right technique and sterile environment, the outcome is clean and safe. We just need to apply that same careful approach to how we interact with our cats and their environment during this precious time. So in this video, we're going to go through everything step by step. We'll break it down into clear, manageable tips that will empower you to protect yourself and your baby without having to part with your purring companion. We'll cover everything from the litter box, which is the #1 area of concern, to feeding and even gardening. By the end, you'll feel confident and prepared, knowing you're doing everything right for your growing family, both the human and the feline members. Let's get into it. All right. Let's start with the most important area, the litter box. This is where the parasite that causes toxoplasmosis, Toxoplasma gondii, can be present. The absolute best-case scenario, the gold standard for safety during your pregnancy, is to delegate this task completely. If you have a partner, a roommate, a family member, or even a trusted neighbor who can take over litter box duties for the next 9 months, that is your safest bet. It completely removes the primary route of exposure from your daily routine, giving you total peace of mind. Think of it like this. You're the lead surgeon in the operating room of your pregnancy, and you need to keep your hands clean for the main event. So, you delegate the prep work to your trusted team. It's not about being demanding. It's about risk management and protecting the most vulnerable patient, your unborn baby. Explain the importance of this to your support system. Most people, when they understand the reason, will be more than happy to step up and help. It's a small, temporary change that makes a huge difference in ensuring a safe environment for you. Now, I know we don't all live in a perfect world. Sometimes you might be the only one available to clean the litter box, and that's okay. We just need to be extra careful. If you find yourself in this situation, you need to create a barrier between you and any potential contaminants. This means you must wear disposable gloves every single time. Don't even think about scooping without them. The gloves act as your first line of defense, preventing any direct contact with your skin. Once you're finished scooping and have disposed of the waste and the gloves properly, the next step is crucial, thorough hand washing. And I don't mean a quick rinse. I mean getting soap, warm water, and scrubbing for at least 20 to 30 seconds. Get under your nails, between your fingers, and all over your wrists. This two-step process, gloves, then a meticulous wash, is your personal protective equipment, your PPE. It's non-negotiable. It's the protocol you follow to ensure that even if you have to do the task, you're minimizing the risk as much as humanly possible. Let's talk about timing because it's incredibly important here. The Toxoplasma parasite is not immediately infectious when it's passed in a cat's feces. It actually needs some time in the environment to sporulate, which is the process of it becoming mature enough to cause an infection. This process typically takes anywhere from 1 to 5 days. This little piece of information is your secret weapon. It means that if you are diligent, you can get ahead of the problem before it even starts. By cleaning the litter box every single day, you are removing the feces well before the parasite has a chance to become a threat. A daily scoop is one of the most effective strategies you can use. Don't let it sit. Make it a non-negotiable part of your or your helper's daily routine, just like brushing your teeth. This simple act of consistency dramatically reduces the likelihood of infectious oocysts being present in the litter box, making the entire environment significantly safer for you and your baby. It's proactive care at its finest. We talked about washing your hands after cleaning the litter box, but let's expand on that. During pregnancy, you should really elevate your hand hygiene game in general, especially when it comes to your cat. Think about all the ways you interact with them. You pet them, you cuddle them, you might get a little lick or a nuzzle. You also handle their food bowls and their toys. While the risk of getting toxoplasmosis from your cat's fur is extremely low, it's all about eliminating any possible pathway for germs. So, make it a reflex. After a good cuddle session, go wash your hands. After you fill their food or water bowl, wash your hands. If you've been playing with their favorite feather wand, wash your hands. Use warm water and soap and be thorough every time. This isn't about being afraid of your cat. It's about practicing the kind of mindful hygiene that protects you from all sorts of things, not just toxoplasmosis. It's a simple, repetitive action that becomes a powerful shield for your health during these critical months. Let's move outside the house for a moment and talk about the garden. For many of us, gardening is a relaxing, therapeutic activity. But when you're pregnant, you need to look at your beautiful flower beds a little differently. Neighborhood cats, or even your own cat if they go outside, may see your soft garden soil as a giant, convenient outdoor litter box. This means that the same parasite we worry about indoors could be lurking right there in the dirt where you're about to plant your petunias. Because of this, it's essential to wear thick, protective gardening gloves every single time you work with soil. Don't just dig in with your bare hands. The gloves create a vital barrier. And just like with the litter box, after you're done gardening, even if you wore gloves, you need to wash your hands and arms thoroughly. This simple precaution allows you to continue enjoying your hobby while protecting yourself from a hidden risk. You can still have a beautiful garden, you just need to suit up properly before you start digging. One of the most effective ways to control what your cat is exposed to is to control their environment. And the best way to do that is to keep them exclusively indoors. Cats that roam outside are far more likely to come into contact with the Toxoplasma parasite. They can get it by hunting and eating infected prey like mice or birds, or by coming into contact with soil or another cat's feces that contains the parasite. An outdoor cat is an unknown variable. You simply can't be sure what they've been up to. By making the decision to keep your cat indoors for the duration of your pregnancy, and ideally for their whole life, you drastically reduce their chances of ever contracting toxoplasmosis in the first place. An indoor-only cat that eats commercial cat food is highly unlikely to be a carrier. This one lifestyle change for your pet provides a huge layer of protection for you. If your cat is already an indoor cat, fantastic. If not, now is the perfect time to make that transition for the health and safety of your entire growing family. Just as we set boundaries for where our cat goes outside the house, we should also set some inside the house, especially in areas related to food and sleep. Let's start with the kitchen. Your kitchen counters and dining table are where you prepare and eat your food. The last thing you want is for your cat to jump up there, potentially tracking invisible germs from their paws or litter box onto surfaces that your food will touch. During pregnancy, it's best to enforce a strict no cats on the counter rule. The same logic applies to your bed. While cuddling with your cat at night can be comforting, your bed should be a sanctuary of cleanliness. Keeping your cat out of the bedroom, or at least off the bed, prevents any potential transfer of germs to your sleeping space. It might be a tough change if your cat is used to snuggling with you, but it's a temporary measure for a very important reason. Create a cozy, alternative sleeping spot for them nearby, so they still feel close to you without sharing your pillows. This is a really important point that often gets missed. While we focus so much on cats, one of the most common ways people get toxoplasmosis is actually from eating undercooked or raw meat. The same parasite, Toxoplasma gondii, can form cysts in the muscle tissue of animals like pigs, lamb, and deer. If you eat meat that hasn't been cooked to a safe internal temperature, you could ingest these cysts and become infected. This has absolutely nothing to do with your pet cat. So, during your pregnancy, you need to be incredibly diligent about food safety. Use a meat thermometer to ensure everything is cooked through. For whole cuts of meat, the safe temperature is at least 145 degrees Fahrenheit or 63 degrees Celsius, followed by a 3-minute rest time. For ground meats, it needs to be at least 160 degrees Fahrenheit or 71 degrees Celsius. No more rare steaks or pink burgers for a while. It's a sacrifice, I know, for all the foodies out there, but it's a critical step in a comprehensive approach to preventing toxoplasmosis from all potential sources. Just like with meat and gardening, we need to think about our fresh fruits and vegetables. Produce that is grown in soil could potentially come into contact with contaminated soil or water. The parasites oocysts can be very resilient and can cling to the surfaces of the food we bring into our homes. This is especially true for anything you might eat raw, like salads, or fruits where you eat the skin, like apples and berries. A quick rinse under the tap might not be enough to dislodge them. Therefore, you need to adopt a thorough washing protocol. For firm produce, like potatoes or melons, use a vegetable brush to scrub the surface under running water. For more delicate items like leafy greens or berries, wash them carefully in a colander, making sure all surfaces are rinsed. Some people even like to use a commercial fruit and vegetable wash for extra peace of mind. Taking these extra few minutes to properly clean your produce is another key step in closing any potential loopholes for exposure. Your own indoor cat, whose history and habits you know, is one thing. Stray cats or very young kittens from an unknown background are another story entirely. Stray cats are at a much higher risk of carrying toxoplasmosis because they hunt for food and live outdoors. You have no idea what they've been exposed to. As tempting as it might be to rescue a friendly stray you find during your pregnancy is not the time to bring a new unknown cat into your home. The same caution applies to new kittens, especially those from shelters or farm environments. Kittens are more likely to be shedding the parasite for the first time if they become infected. If you are considering getting a new cat, it is much safer to wait until after your baby is born. For now, focus your love and attention on the furry friend you already have. Avoid handling or getting too close to cats whose health history you don't know. It's a simple rule of thumb: stick to the cat you know and trust. This tip is for those of you who may already have children, or who have a sandbox in your yard for any reason. Just like your garden, a sandbox can look like a giant, pristine litter box to every cat in the neighborhood. It's soft, it's sandy, and honestly, it's an irresistible temptation for them to do their business in. This can turn a children's play area into a significant source of potential toxoplasma exposure, not just for you, but for your other kids as well. The solution here is simple but absolutely critical. Keep the sandbox securely covered whenever it's not in use. A tight-fitting lid or a heavy-duty tarp that is weighed down at the edges will do the trick. This creates a physical barrier that denies cats access. Make it a strict rule that the sandbox gets covered the moment playtime is over. This ensures that the sand stays clean and safe, and you don't have to worry about what might be lurking just beneath the surface when your child, or even you, goes to play. Your veterinarian is an invaluable partner on this journey. They are a wealth of knowledge not only about your cat's general health, but also about zoonotic diseases, the ones that can pass from animals to people. Schedule a checkup for your cat when you find out you're pregnant and have an open conversation with your vet. You can discuss your concerns about toxoplasmosis and ask about your cat's specific risk factors based on their lifestyle and history. Your vet can also ensure your cat is up to date on all their necessary vaccinations and parasite control measures. While these don't directly prevent toxoplasmosis, a healthy cat with a strong immune system is always the goal. They can also offer more personalized advice on things like diet and transitioning an outdoor cat to an indoor lifestyle. Don't hesitate to use them as a resource. A quick consultation can provide immense reassurance and confirm that you're on the right track with all your safety precautions. Finally, let's talk about your cat's diet, because it plays a direct role in their risk of exposure. As we've mentioned, one way a cat can contract toxoplasmosis is by eating infected raw meat. Therefore, it is absolutely essential that you do not feed your cat any raw or undercooked meat while you are pregnant. Sticking to commercially prepared cat food, whether it's dry kibble or canned wet food, is by far the safest option. These foods are cooked and processed in a way that eliminates harmful parasites and bacteria. Also, avoid giving your cat unpasteurized milk, such as goat's milk, which can also be a potential source of pathogens. The principle is simple. A controlled, safe diet for your cat means a lower risk for you. By feeding them only commercially prepared foods, you eliminate a major potential pathway for the parasite to enter your home. It's an easy switch to make, and one that gives you complete control over what your cat is ingesting, which in turn helps protect you and your baby. And there you have it. We've gone through a comprehensive list of precautions, from the litter box to the kitchen and beyond. It might seem like a lot to remember, but these are all small, manageable adjustments to your daily routine. The most important takeaway is that you do not need to give up your cat just because you are pregnant. With these sensible safety measures in place, you can continue to enjoy the love, comfort, and companionship of your furry friend throughout this incredibly special time in your life. Your bond can remain a source of joy and stress relief, which is so beneficial for both you and your baby. Remember, knowledge is power. By understanding the risks and knowing exactly how to mitigate them, you are in complete control. You're creating a safe harbor for your growing family. The joy of feeling your cat purr on your lap, not on your belly perhaps, while you dream about your future, is something you can and should continue to cherish. These precautions are temporary, but the love for your pet and the health of your child are for a lifetime. You're doing a great job, and you can navigate this journey with confidence and peace. Of course, every pregnancy and every pet is unique. If you have any specific questions or lingering concerns, please do not hesitate to speak with your healthcare provider, your OBGYN, or your veterinarian. They are your best resources for personalized advice and can offer reassurance based on your individual health history and your cat's lifestyle. Thank you so much for watching. I wish you a healthy, happy, and perfectly wonderful pregnancy. Take care.